when I speak to some people, they say, "Oh, I have a plan. I can pay. Go to the doctor. I pay $50 to do so." But then when we look into actually what the deductible is, the point where the plan is going to help you out paying, it might be 9,000. So that means you have to spend $9,000 before they actually, something happens. They pay, but people don't know these things.
Patrick Findaro here, co-founder at Visa Franchise. Today I have a special guest, Magnus Holm. Happens to be my dad's neighbor. Our kids met playing in the same pool. I would say probably about a year ago. Magnus is originally from Sweden. He's lived in Switzerland, lived in Brazil. He's started businesses in different countries, so can definitely relate to the clients that are listening in. And now, out of Miami Beach, he is acting as a healthcare advisor, helping our clients, whether you're an entrepreneur, professional, evaluate different healthcare insurance options for you and your family. Magnus, thanks so much for joining today.
Thank you for being here. Thank you for having me. I'm excited to be here and see what I can come up with, what I can answer if your questions you might have for me.
Magnus, I'm sure you can relate with a lot of our clients as you came on an investor visa category. You know, you were living in Brazil in the time, but you came on the EB5 visa. Was that it?
That's correct. Yeah, I came on an EB5 visa. The whole idea was to come and open up a cafe. Was the initial thing I wanted to do. However, things changed during the process, and then, long story short, I ended up doing this instead, health insurance.
And what inspired you? Because I know when we first met, you were looking at different businesses, commercial cleaning, residential cleaning. You had some great ideas, and I'm sure you looked at a gambit of different businesses to start in the U.S. Why help people with what I see as better understanding healthcare options in the U.S.?
Yeah, I mean, I come from a hospitality background, and so I naturally like helping people and being there for them. And as I came here, I realized we're looking into health insurance ourselves, and I thought it was complicated in a way. And then, just a coincidence, I just found, it was an opportunity to take my license and learn, and so I did. So I came in that way, and then as more as I learned about health insurance, I realized that there's so many people here that don't really understand what it's about. It's not really that complicated. It can be, but felt like I wanted to make a difference and help people. There are many people in the United States that go without insurance, thinking they can afford it. They have these kind of preconceptions of what the different plans are. Some what to look at. So with that in mind, I just want to make a difference and help people, help them along to find coverage.
And Magnus, what aspects of the U.S. healthcare system do you find most challenging for foreign entrepreneurs, international entrepreneurs to navigate?
It's the whole setup, I guess. You have to know, first of all, everything kind of comes together. It's people, when I look at insurance, they mainly just look at the premiums, for instance, or the deductibles, and they don't really understand that everything goes hand in hand somewhat. So a deductible is basically point which you pay towards, and when you reach that limit, the deductible, that's when your health plan actually helps out and help you pay for your health costs. From there on, you then move on to something else. You go into co-insurance, which is basically you pay a percentage of the cost and you share together with the insurance company, and that you continue to do till you reach your max out of pocket, which is your stop loss. And some plans they don't have this at all, and some plans they do. It's just different kinds. But it's important to have a plan which has a max out of pocket, a stop loss. That's going to be then what you max pay. So when I speak to some people, they say, "Oh, I have a plan. I can pay. Go to the doctor. I pay $50 to do so." But then when we look into actually what the deductible is, the point where the plan is going to help you out paying, it might be 9,000, same as the max out of pocket. That means you have to spend $9,000 before they actually, something happens. They pay, but people don't know these things.
And Magnus, a lot of our clients are family of four moving to the US. They want to have pretty good coverage. What are we talking about on a monthly basis? Is that $2,000? I know it's going to vary a lot depending on their state and pre-existing health conditions, but what's like a general ballpark figure someone should budget?
It all comes down to how much coverage you need and what you want to do. I say the first best thing is to do to kind of decide the actual needs you have, what kind of coverage you have. Do you have a pre-existing condition that limits you maybe to some plans, which you have to obviously, if you see the doctor a lot, then you maybe want to look into a plan which has a low deductible, meaning that they will help you out earlier. And for that, when you have a low deductible, the premium, what you pay per month, is normally higher. If you're somewhat healthy, You might say, you know what, I'm going to pay a lower premium and have a higher deductible, and that way, when something comes around, you're ready to carry that the cost yourself more in the end. Trying to answer the question, what it would be like, it all depends also what plan you're on. Are you looking at a private plan? Are you looking at the marketplace, or what they call here Obamacare plans? It all depends, because some of the plans, they base the cost of where you live, your zip code, your income, and your age. That's one of them. And then you have plans that where you qualify with your health. So I would say somewhere around, I'd say 1,500 maybe to 2,000 for somewhat, ballpark figure maybe would be even more, depending. Like I said again, if you use the plan a lot and you would like a plan with a low deductible where the health plan will help you, then your premium is going to go up. So then we're talking probably more for family of four, probably above $2,000.
And Magnus, that was my next question, where it's like, what are the first steps for international entrepreneurs as they select healthcare coverage, insurance? And a big thing, I guess, is really assessing what they need for them and their family, and kind of their risk appetite and how
Mm.
much money they have saved up for a rainy day. Should there be, a big event, do they have 10K, 15K that they can cover, I guess, the medical bills? No.
I think it's important to have an overall view, try to get an main understanding of what these components are and how they work together, act together. That's the most important thing, I think, when you're starting to looking at insurance. And of course, speaking to someone like me, someone who knows, who's an advisor, knows the ins and outs, would also help, of course. But first is to assess what kind of coverage you would need and take everything into consideration. Do you have someone who needs special attention, maybe needs to go to specialist? Some plans that don't offer that. Well, they do offer it, right? But you need to go through another doctor who decides for you. In that case, you need to look at a specific network. I would say, yeah, looking into these things, assess your needs is the most important thing. And then, of course, the more you use, or a high user, then it might be more expensive. And it's very vague to say. It's more, if I would have an example clearly for someone, and that's when I meet with people, I try to figure out where they are. Are they going to be high-end users? Just go to the doctor once in a while. But most importantly, what you should keep in mind is to look at the overall picture. Why do we have insurance in the first place? We have insurance for that big, accident, car accident. If you have cancer, these expensive things, that's why you have it. Many people are just go in and they look at, the doctor. If you go to doctor, at least here in Florida, it's an average cost of 200. So, I mean, you won't break bank if something happens. You need to see the doctor.
And Magnus, I know you did a great job helping my colleague, where I really viewed you as a key advisor to me and my colleague to see what was the best, because he was coming from abroad, moved here on an O1 talent visa. We sponsored him, and it was a unique situation, different family members. You laid out the options, and one of the options was our company, having our company plan, I guess maybe the marketplace. But I liked how you weren't trying to sell, the one that benefited you, and you really had a very high degree of empathy on what was best for this individual and their family. There are some plans that pay, I'm sure, bigger commission or whatever, but I never got that vibe from you, nor did he, as he was going through, what were the best plans.
No, no, that's right. And that's also how I work. I like to help people first. That's it. And what's best for them. Like in every category of work, there's some people that are not that honest. In my business, I know there's some people that just look, like you said, they look for the best commissions for themselves, and I kind of push people towards that instead. The people I work with and the people who taught me the trade, they said it's always better to be honest. And I think that too. Even if I don't make any money, I had some clients where I didn't make any commission at all, zero. But in the end, they're happy, and when people are happy, they're going to
They
recommend you
tell
to
their
someone
friends.
else. Yeah.
Yeah,
So in that
exactly.
sense, you
It's a long term investment.
and also as well, you should got to be able to sleep at night. And no, no, but it's true. I couldn't go to sleep knowing that there was a better option for someone, but I pushed them towards something else because I wanted money in my pocket.
The stakes are high. It's healthcare we're talking about.
Yeah.
We talked a bit about families. That's a big reason why many of our clients are moving stateside. Obviously, the business opportunities, lower taxes, less regulation than a lot of different countries, amazing, huge consumer market. But talking about families for a moment, things to keep in mind, exploring policies that are specific policies or benefits that are more family friendly when exploring this.
Yeah, I mean, again, I think everything. Well, this interview, I'm sorry, but we're gonna kind of get back to the same kind of thing again. But it's again always about looking what you need, right? But it would some plans. There are specific plans for to have. If you're having kids, for instance, that might include dental and vision. In some cases, also there might be. I mean, I can get really complex. Some cases it might be that mom, dad would be on one plan, and then the kids on another because they have better coverage there. So
Do you mind if
finding
we
the
role play a bit? That
yeah,
I choose like a persona for one of our clients?
sure, let's try
All right, perfect.
it.
So my name's Philip. I'm coming from Canada. I've run businesses in the past there. My wife works at a bank, Royal Bank of Canada. Between us and Canada, we were making about 200,000 Canadian, which I think it's about $150,000. I'm investing in a franchise. I'm going to be starting up a business. My wife's going to be seeking employment. So maybe down the line, she'll have healthcare coverage, but she doesn't have a job yet. And we have two kids, 2 and 5 years old. And we just got an apartment in Brickell near downtown Miami. I have some money saved up, that if I needed liquidity to pay for a big hospital bill, or God forbid someone in my family got cancer, 15,000 cash that, we have to spend.
Mhm.
But what are my options? What can I consider, Magnus?
Yeah, well, first of all, you can when you're looking at if you earn somewhere around 150,000, I think you wouldn't qualify. It all depends on the actual zip code. I don't think you would qualify for any, subsidies. But again, then you have to go. You can definitely look into if you would. So what does that mean if you don't qualify for any subsidies? It's just that the plan would be a little bit. You pay the full price. And some better plans they could be expensive. So in this case, I would take notes of the ages of the people, and I will look into the actual marketplace and see what kind of plans would be available. I would ask questions specific about if they're taking any prescription drugs, if the kids have any issues or whatever it might be. And also in the end, there are other private plans where you qualify with health, and if that would be an option also, then I would look into that. However, it all depends when it comes to have this kind of. So what I do is I kind of have this kind of conversation first, where we talk what I want to be, how much also. Do you have an insurance from before? That's actually the first question I ask. Do you have insurance now?
Nothing in the US. I just moved from Canada, and, I moved on the E2 visa, starting my window washing business. So I'm just
Okay.
starting to get some revenue in, but it's probably going to take about 6, 9 months to start drawing a profit from the business. I
Okay.
imagine this year I won't make much, maybe, 20K, but I'm hoping next year it hits 100K plus. And then at the same time, I'd imagine my wife would get a job that would also help contribute to the family. But does it make sense for me, Philip, to do the insurance as Philip and my family, or is it better maybe that we look at like an employer plan for the company that I set up, the franchise business?
So Philip, it would be, I say, if your wife finds a job, maybe there might be an option for her to jump on a healthcare plan there. And those are actually the most common ways you're being insured in the United States. And in most cases, they have really good plans. You don't pay that much for it as well. The employer pays the majority of the cost. So that would be an option. As I mentioned before, the federal marketplace we could look at, and making 20,000 or above there, then I think you would qualify for some subsidy. So that would be an option also to have a look at.
I have to touch base with my immigration attorney on it. I'm a little worried because I might try to apply for a green card one day, depending on how my family adapts here.
Mm,
And I know, and I'm a little afraid with Trump. And I know in the past there's been issues with getting a green card if you've taken, subsidies, or you've had government aid. So I guess it's good to know that that's an option. But I definitely, maybe we'll connect with my immigration attorney and see if it's a viable option going down the market path, or maybe there's a bridge of 6 months, 9 months that I work with you getting insurance documented, and then we look to, hopefully my wife gets a stellar job, then that gives good health care insurance.
yeah, I mean, what to consider when you're on a subsidy, I mean, it's just to keep them up to date, so you know what you're paying. So if you're all of a sudden making, I don't know, 80,000, if you notice that there's going to be a jump, then you have to, of course, let them know that you're going to earn more, and therefore you're not going to get that tax credit in the end. So there's always ways to fix around it as well. Also, if it goes well for your business, Philip, I don't know if you have any employees or thinking of that. You could also
Right
look
now, they're
into.
independent contractors, so what we call 1099s
Yeah.
in the US. We have a different term for them in Canada.
Mm.
But I'm looking to hire some employees, and it's a tough job market. It's very competitive now. The job market's quite tight here. So I want to hire an employee, going into Q1, Q2, 2025 on W-2, and maybe it would be enticing if I help subsidize some of their healthcare, I guess.
Yeah, I mean, there are options again. There also you can do to offer health insurance for them. There's, you can look at group plans, smaller ones, or you can now also look at, if I'm going to line up, you can also offer them individual plans, where you look individual at people, and then of course you can then use that as a tax deduction in the end of the year as well.
Magnus, how does it work? From what I understand, if I get coverage myself, like they could, examine me, make sure I'm healthy or whatever. But if it's done through a company, and say my son's on the spectrum of autism and I've had a heart attack in the past, is the company going to have to pay more? Am I going to have to pay more? How does that work?
No, I mean, it's the insurance again that takes care of. If you're autistic, for instance, in that case, I would also look into to options. If I would know that from the beginning, if you have your son is autistic, then there are specific plans that are good for that. Here in Florida, I have something. It's a governmental program which is called Florida Kids or Kid
Oh,
Care,
nice.
which you can get into. It's for all kids. It's basically saying that it doesn't matter if your parents not have insurance, but it's for you and your kids. You can be, and if you're low income, you get a subsidized plan. If not, you will pay a full price, but still a very good price. And they specialize in they have specific programs which would be able to help with autistic children, for instance.
Magnus, what are some mistakes that international entrepreneurs like myself have made, and kind of common pitfalls as they go about the process? I imagine, like you started, some people think they can't afford it and they just
Yeah.
don't do any health insurance. What are some other mistakes, common mistakes that you see by the time someone gets to your desk?
I think they just focus on one thing. They just look at, for instance, the premiums, what you're going to pay, that's it. And I focus on that solely. That's very common mistake. There are many factors. I usually say when you're looking for a good health plan, there's two things that are very important to know. Your network is number one. When
What
what
do
I
you, what is network? What is
what I mean
that? Can
with
I
with
just go to
network
any
is
doctor?
that is your what the kind of connections you have, your how many doctors, hospitals you have access to, and it all depends. I can go in and discuss all these different kinds of plans and name of different networks, but to make it simple, there's something you should consider because you have small networks and you have obviously bigger ones, and the small ones, local ones, obviously cost less. And then another super important factor is your protection against out of pocket cost in the end. So I had the client actually I spoke to a year ago. We're going over her plan, and she told me I have this fabulous plan. She had a $0 deductible, meaning that the plan would pay directly if something happened to her. Her max out of pocket maximum what she would pay for a year was $2,000, which again is super low.
Yeah.
Excellent plan, and she paid
What
very
was
little.
attached? This sounds too good to be true.
She paid very little for it, right? So here we come into the problem with the network. So I looked at the actual insurance company, and I didn't recognize the name. It was some small company, and I told her like, look, if I haven't heard of this company at all. So my concern is if something happens to you, you need then your network is going to be very limited. Fast forward to now, for a week ago, I spoke to her and she was really upset, and she said, I was walking into a minute clinic, which is here in the United States is all insurance plans would take that. That's nothing. You don't need
Yeah.
any fancy insurance.
That's like an urgent care to
Yeah,
basically, so people listening, you avoid going to the emergency room because it's not that grave, but you want to get attention fast and not have to wait for a
yeah.
doctor's appointment.
So she walked in there, and her insurance wasn't covered in the minute clinic. So that tells you. There you have it. She has excellent, the deductibles, all these things was nice, but the network was not good at all. So these things you have to keep in mind. And some people, especially if you're new, you don't know, right? So someone would maybe present that to you. Someone who wants to sell you something will say, "Look here, this is great," and explain everything, and you would think, "Wow, this is excellent. I will pay only 150 flat," and then they take it.
And I know you have some vertically integrated groups where they have insurance, they provide the care, but you could sign up for one of these plans and the doctors are what, 45 minutes away and they have very limited availability. So,
Yeah, and you have to fight for everything in the end also. If you want the insurance to pay, they don't cover it. There might be other things that kind of, yeah, also to keep in mind if you're looking for plans when you come as new, also to make sure, this is very important, that your plan has unlimited coverage. There's some plans they sell to you which are capped, and it might sound very good. 5 million sounds like a lot of money, but it's not if you have a car crash or, God forbid, cancer or anything serious. It's not that much coverage. So that's also one factor that's important to know, that you have unlimited coverage afterwards. So when you reach your max out of pocket, the maximum you will pay in a year for your insurance, if it's 9,000, which is common for the marketplace, then the insurance will take over the rest. Either it's millions or whatever, then they will cover it. That's important to know or have.
Magnus, a lot of our clients are taking a step back in their move to come to the US to take a step forward. So maybe they're in their home country, they're making $100 to $300,000 plus a year, and they're living pretty comfortably. But they're coming to the US, and the first year they're not going to make any money or barely,
Mm,
and then it's building for the second year and third year. So cost is a big thing. And maybe if they went through the E2, they invested 100K plus. EB5, it's gone up since when you did it. Now it's
yeah.
$800,000. So it's serious cash. Where the last thing someone wants to do is now allocate more money to an ongoing expense. So how can entrepreneurs and top professionals think about the cost effectiveness and balancing comprehensive coverage for you, and especially if you have a wife or spouse and kids, and with cost effectiveness?
Well, when looking at this cost effectiveness and to get a good comprehensive coverage, again you have to evaluate how much you're going to use the plan, what kind of networks you're going to use. Like I said, there's some small networks they're called HMOs. You have PPOs which are nationwide or widely coverage. You have to look at also there are some things you can't take advantage of. Some people they don't consider it. Like I said, the marketplace, maybe you will qualify for a subsidy. It's about being open to look at alternatives and not being afraid to review things, or even splitting up. Some many families they think like the best thing to do is to just to be on one plan. You can split up, mix and match, if I would say, and of course speak to someone like me that knows know myself way around the complicated area of health insurance. So it's good to speak to
And you've
someone who
worked with
knows.
a lot of people coming from other countries, whether it's Europe, Latin America, Asia. So there's definitely some intricacies and
Yeah,
some differences, and also you can explain it in a way that kind of matches their language, whether it's literally in Portuguese, because I know you speak Portuguese.
I do.
Any
I
other
do.
languages? You have Swedish,
Well,
Portuguese.
the Swedish language, Swedish, of course, and if you're from Denmark and Norway, listening
You
to this, you know that also
communicate.
very similar, so you can get around. Yeah, Portuguese and then English, of course. I do know some German. I used to live in Switzerland, so
That's
I
right.
can understand, and yeah, I can probably communicate there also. And then I'm studying since I live in Miami. Most people speak Spanish. I've started to study
Yeah,
that as well.
awesome. So you got the coverage and Magnus, from our conversations, you working already with one of our employees and the case studies that you shared with me before, it does seem like something that's quite customized, and there's usually, a few different options to really dive into, but it's important that working with an advisor like yourself, international entrepreneurs explore the different options available and knowing well that these things might change, and using understanding the family dynamic where if you have a spouse that's working, that could be the plan A, but if not, then there's going to be different options to consider, short term and long term. Magnus, anything else that you wanted to get across today?
Not really, but I mean, it would be if anyone needs any help, you can contact me and speak to me. I'd be happy to help out and look into to whatever situation you might need. In. So to speak of your,
Perfect, Magnus. What's the best way for people to get in contact with you?
so that would be I can leave my phone and an email. So call me and then can schedule a meeting and talk about what the needs are and what you're looking into. Again, it depends. Like your employee there, Patrick. came, his wife was pregnant. So at that point, you have to look at specific plans for pregnancy. Maybe afterwards, when they have the child, then it doesn't make sense to be on that plan because then you're paying towards
And
pregnancy, for
checking the
instance. And then you,
doctor,
yeah,
the doctor's office that
exactly.
also
Yeah.
delivered my babies, making sure that the insurance was covered.
Yeah. So yeah, speak to someone who knows. Do a little bit of research first, maybe. If you, I know there's a lot could be overwhelming coming to a new country, but just have a little overview, know some things maybe, and then speak to someone like me who would know, and then help you out and explain. And then from there on, what I do is just basically narrow down the whole thing. So you have a few plans, and then from there you can say yes or no. And also worth mentioning, if you don't want to, if you work with me and if you're not happy or don't want to do anything, there's no strings attached to what I do. So I present, we find something, and then whatever you do is completely on the client afterwards.
Perfect, Magnus. Well, we'll be sure to include your contact information for anyone that's interested in further exploring their health insurance options in the States. And just want to thank you again. Appreciate for spending the time for this interview.
Thank you for having me, Patrick. Thank you.